Hello everyone, welcome to another dose of dental tips of the week with me, Dr. Sherwin from Artistic Dental Studio. I'm really excited to be here to share with you an exciting topic, which is toothache. And the reason why it's exciting is because we can actually get involved in such a thing, and it's possible for any of us. So what I'm trying to cover for today is just what you need to do if you're away from a dentist for any given reason. For example, it's a camping trip, or there is a holiday season and you can't reach a dentist. So what do you need to do, and how could you control the pain? So in order to do that, I need to tell you something about the pain, because dental pain or pain in the oral region could come from different sources. Hello Adrian, how you doing? Thank you for watching. Hi Marjan, hi Paria, welcome. Hi Shana, welcome. First of all, let's categorize the different types of pain. The dental pain could have different forms. The most popular form of dental pain is in the form of a mild pain and sensitivity, and it's mainly a sensitivity to cold and sweets. This is the most common one, and normally it comes from a cavity. Whenever there is a cavity into the tooth or some dental decay, patient may feel this sensation of cold or some sharp pain when eating something like sweet. And what needs to be done in these circumstances, you first need to make sure you avoid the triggers. That's very simple. So you need to steer away from the very extremely hot or extremely cold kind of foods and beverages, also extremely sweet ones. The second thing you need to do is to keep that area clean. If possible, sometimes the cavities are located between the teeth and it's really hard to keep clean. And food may get jammed between the teeth and cause even more problems. But doing proper brushing and flossing could make sure that the cavity is free of bacteria, which could cause even more irritation. The second thing you can do is that you'd better just you can take some normal kind of painkillers. It could help to some extent, but it's not guaranteed, obviously. And that's pretty much what you can do in this type of pain until you can get to a dentist and get the cavity fixed. The second type of pain, which is also common, and unfortunately also common, I would say, because it's a pain that is quite excruciating. It's really hard to bear. It may even disturb you at night, and it's in a form of a throbbing, sharp pain that is really hard to bear. And this kind of pain normally comes from the nerve within the tooth. And the nerve could be irritated by several means. For example, it could be either decay, it could be either gum disease or any source. So at this point, nerve inside the tooth is irritated to an extent that we call it an irreversible state. So nothing could be done. You need to seek dental treatment as quickly as possible. But before getting to a dentist, what you can do, first of all, as usual, avoiding triggers. That's okay. Whatever causes the pain. The second thing, hygiene. Okay, it's common in all forms of dental pains. And the third thing, you can take some kind of painkillers, like the ones that actually contain some anti-inflammatory component, like the ones that contain ibuprofen. This could greatly help you alleviate the pain, reduce the amount of pain, all right? But let me tell you something about the medications. Whatever medication I'm talking about in this video and the next ones, please, you need to make sure that there is no side effects. I know there are side effects with any kind of medication, but you need to check them out and make sure there is no side effect for you as an individual in relation to your systemic health. That's really important. Some even normal painkillers may have create some drug interactions. For example, you're taking another medication and this one actually causes some interactions with the previous one and could cause you trouble. So you need to be careful and make sure that it will not be something quite dangerous to you. And so let's just sum it up. Avoiding triggers, keep the tooth clean, and use that painkiller with some anti-inflammatory component. And get to the dentist as quickly as possible, please. Why? Because this type of pain could assume different courses. It could just turn into a big abscess and cause you a lot of problems. You may even have to go to the hospital to, just get the abscess drained, and you need to go under, I would say, extreme, kind of antibiotics administrations and regimens, and that's very nasty, to be very honest. So we better just try to avoid such situations. And the third one that I'm going to cover for today is dull, boring pain that you may feel around your gums. It could be localized, for example, lower front teeth, or it could be widespread all around the mouth. It normally comes from gum disease. And what is gum disease? That's the question. Gum disease is normally caused by deposits, dental plaque, and tartar. Once allowed to build up on the tooth surface, then the bacteria that are actually nesting into that plaque or tartar begin to eat away the bone around the roots of your teeth. And that's the process of gum disease. So what you need to do, you need to make sure you attend your 6 monthly checkup and clean sessions to get rid of that tartar. That's really important. But if you get caught with something like a vague pain, what do you need to do? First of all, you need to make sure you could keep the area clean, which is really hard in these circumstances because some spaces may be completely blocked by tartar, and you cannot even pass the floss down there. So that's the tricky point. You need to make sure you can keep it clean. If not, something that could really help you is to use some antimicrobial gargles. They are all, you can find it in any kind of pharmacy. But make sure this antibacterial gargle doesn't contain alcohol, because it could aggravate the problem. It could cause more mouth dryness, and because saliva has a protective role overall, it actually offset that role. So it may cause the situation to even get worse. And another thing that could help you very, very much is to do some massage on the gums. That's really good, because by doing the massage, you increase the blood circulation to the gum. Therefore, you increase the nutrition, and gum could actually defend itself against bacteria and bacterial attack. There are different types of pains that I will cover in next week's video. But what I need you to do, please put your comments underneath in the chat box. Ask any questions you may have. And please share this video with your friends. And I hope you have a very nice day. Enjoy the rest of your day. And thank you very much. See you next week. Bye.